Okay guys, so this is X-ray example number 2 of what I've done today. So this will be a dorsal ventral thorax. So I'm going to come down through the dorsal aspect and out the ventral aspect. The VD view would involve putting them into a cradle. In this scenario I'm going to work a little differently, and I'm going to assume that he is under GA and therefore not sedated. And again, if you have it where you do not have to collimate to a plate, then you do not need to do the first step. But the first step would be to select your relevant size plate for the X-ray. So based on this dog, I've gone for a medium. Medium or large would be fine for any of your thoracic views. And I'm going to make sure that my plate and my centre point are where I want them to be, and I'm going to make sure that I've collimated to my plate. Again, if that is not required for your syllabus, you do not need to do that. I'm going to comment if I need a grid, and because he would be over 10 centimetres, yes, I will need a grid. And I would ask my assessor to help me with strains. Similar to the other videos, like I've said, I would always focus on supporting the airway, and I would ask the assessor to support the back. And then once I have him in lateral, I would say we're going to move him into sternal now, if that's okay. If you can just help me turn him into sternal. And you're looking to be really gentle with that head that you're holding, and that you're supporting him as necessary, because you want to imagine like they are a real toy. I'm then just going to pay attention to his position and just check that I want my X in that mid-thorax. I'm going to say to my assessor, actually we're going to need to move him back slightly, which is what we had to do with the last thorax as well. And I'm going to do that now before I start positioning, because I think that's actually going to make more sense. And it's going to be more comfortable for him, so excellent. So we're going to go there, so we're in line with that thoracic inlet. So just to give you a demonstration of that, based on the light, I want the light in line with the thoracic inlet, which in this view will look like it comes in line with the shoulder down the side, but also like back of the head basically. I can't collimate it any less this side, so it will go slightly past the last rib, but that's okay. And then we'll talk about our centering points a little bit more later, but I'm happy with where he is for now. Now I said this time I'm going to assume he's under GA, so I need a lot less sandbags, which is often the case with this position, because it would be quite a lot to often put their heads kind of under a sandbag. But I am going to prevent rotation, so I am going to pop 2 wedges just either side of his chest. Got my big wedges. Put his forelimbs forward, and I am going to pop my right and left marker on. So I'm going to double check my positions, and I do like to do it fully. Put your hands out, check your rights and left, and again, as long as I know that's inside my field of view, because I've already collimated, I know that that will be included, so that's absolutely fine. Now that I'm happy that he's in the right position for a dorsal ventral thoracic radiograph, and I'm happy with my position, I'm going to talk you through the lighting. Now, because I've picked a medium plate, as I did in the first thoracic scenario, I've kind of come to the exact right space I need, and I can't really make it any less, but what I can do is bring in my edges, and I'm just going to make sure that I haven't cut off that right marker, but I haven't, so that's amazing. So we're centering over the mid-thorax, we're collimating to the thoracic inlet manubrium, whatever you kind of want to say here, but we're collimating to that initial kind of start of the respiratory system. Coming up to the last rib, in this view, we can't now collimate any less, otherwise we would cut it off, so we've gone there. And then we're doing our lateral skin edges. In this view, if I did try to collimate to the last rib, which is what a lot of people do, you cut off the shoulder, and that costs you marks because you don't have the thoracic inlet. Sometimes you just can't get it directly where you want it, but it's important that you have the whole of the thoracic cavity. That's more important, so make sure you've collimated correctly for what you need there. And that's a thoracic dorsal ventral radiograph for you.